again, I think what's nice, again, we've got, so again, if we get back to the disease continuum slide that I think serves as a reference point, and I think every urologist needs to understand this, is that in the current regulatory market, and again, I think we need to understand the differences about what is theoretical, what is physiologic, what is regulated, is that currently what's approved in the docetaxel failure state is cabazitaxel, abiraterone, or Zytiga, as well as Xtandi or enzalutamide. The beauty about it is that yes, that's what's approved. Obviously, we can talk about the theoretic advantages, which we'll do later in terms of the sequencing of these drugs. But what also is exciting is that there's probably another 2 or 3 agents that are currently in clinical trials in phase 3, again, with unique mechanisms of action. We've got alpha-radin, or radium-223, which is a alpha radiopharmaceutical, which is entirely different from the radiopharmaceuticals that we've used in the past. Because it's an alpha emitter, it has a very narrow depth of penetration, but the early clinical trials suggest that not only has a survival benefit, but also in terms of overall survival just by itself, it also has a wonderful response in terms of pain relief and reduction of skeletal-related events. We've got orteronol, or TAC-700, which again is another oral agent. Plus you have another androgen receptor signaling inhibitor called Aragon, or 509. So I think, again, many other therapeutics still in clinical trial, again, increasing the armamentarium of what physicians have in terms of their ability to treat the castration-resistant prostate cancer patient.